What can be done to stop this mysterious virus?
In order to stop the spread of the virus, we need to understand the mechanisms of infection and then change our behavior accordingly. So far, we have considered two main routes of transmission. One is infection by coming into contact with something that has the virus on it. The other is infection through droplets emitted in sneezes and coughs. But some experts say there is possibly a third infection route.
Experts are now looking at this new infection mechanism as the key to preventing the further spread of the virus.
ただの会話の中で感染が広がっているとか、ある程度の距離があってもそれが広がっているような、そういった事例を見ると、通常の飛沫感染だけでは説明できない、非常に小さな粒子ということで、マイクロメーターの粒子、マイクロ飛沫感染とも呼べるような、そういった状況が起きたんじゃないかなというふうに考えられます。
So how does this take place? NHK is conducting an experiment with a group of researchers.
はい、レーザーください。
The team will track particles in the air using laser beams and a high-sensitivity camera. This technology allows us to detect droplets as small as 0.1 micrometers wide. The experiment starts. First, sneezing. We can see a large droplet about 1 millimeter in diameter. It quickly falls. But let's look through the high-sensitivity camera. We can see small particles that seem to glitter floating through the air. These particles are all smaller than 10 micrometers, or 1/100th of a millimeter in diameter. Let's take a look from a different angle. They're small and light. You can see them drifting through the air. These are microdroplets. We're learning that sneezing isn't the only source of these droplets. We ran the same experiment on a close-range conversation. People generate a lot of microdroplets when they talk loudly. The droplets between these two stay where they are. They don't drift away. It's not yet known what volume of microdroplets leads to infection. But Tateda says we can't rule out the possibility that microdroplets have spread the virus to some extent.
そのマイクロ飛沫、小さな粒子の中にもたくさんのですね、生きたウイルスがいて、大きな声での会話、あるいは激しい息遣い、そういった中でですね、このマイクロ飛沫ができて、それが近くの人、その人が吸い込むことによって感染が広がる、そういったリスクが見えてきたものと思います。
The risk of infection through microdroplets becomes even greater in a closed space with poor ventilation. This lab is simulating the movement of microdroplets in an airtight room. About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the microdroplets, shown in red, continue to drift. This simulation uses only microdroplets. 5 minutes later, 10 minutes later, 20 minutes later, the microdroplets are still floating in place.
空気がよどんでいると、つまり空気の流れがないということで、マイクロ飛沫そのものは、落ちたり、違う場所に動くことができませんので、長時間その場所にとどまるっていうことになります。
But there is a way to prevent this stagnation of microdroplets. Opening windows and increasing air circulation is believed to be effective. When you open a window, microdroplets are quickly swept away. They're very small and light, so any airflow will get rid of them.
"できればですね、2箇所開けて風の流れを作ってあげるということが大事。それが1時間に1回でもいいから、そういうようなことをやることによって感染のリスクっていうのはかなり下げることができるようになるんじゃないかなというふうに思います。
We're now joined by Mitsuo Kaku, a professor at Tohoku Medical and Pharmaceutical University. He specializes in the prevention and treatment of infectious diseases. We just learned how microdroplets move, but we don't know if this brings a high risk of infection for the new coronavirus. Professor Oshitani, you've been watching the actual spread of the virus. Do you think microdroplets are spreading infection?
I don't think airborne infection has occurred. If it had, there would already have been a large-scale outbreak here in Japan. We believe most infections have been through large droplets or through contacts. But it is possible that microdroplets can cause short-distance transmission in exceptional cases, and this can lead to a cluster. People who have mild symptoms still carry the virus. They might not sneeze or cough or even have a fever, but they still release the virus when they talk loudly or breathe heavily. And by doing so, they release large amounts of the virus, and it's highly likely that this is creating clusters.
Professor Kaku, what do you think we should be most careful about when considering microdroplet infection?
You have to avoid the 3 situations Professor Oshitani pointed out earlier.
And what are those?
Closed spaces, areas where many people gather, and close-range conversations. You have to avoid all 3. And it's necessary to ventilate, particularly in medical facilities, where there could be a lot of microdroplets. One place that's a really big concern is the waiting room. Here, lots of people are concentrated for long periods of time. People talk while they wait, and this leads to microdroplets in the air. And if ventilation is poor, that could mean infection. So the air needs to be constantly flowing, and we need to make sure people don't come all at the same time.
Professor Oshitani, those 3 situations you listed, do you think they're a big part of the current spread of the virus?
We saw from the beginning that the risk of infection was very high in these 3 situations. They have to be avoided as much as possible. This is very important in our fight against COVID-19. We've been emphasizing this from the start. But even now, these situations haven't been reduced, You see them all the time, even in large venues with lots of people. Japan has been really lucky so far in that we haven't had any large-scale clusters. But you can't just expect that to continue. If we don't do anything, then there will be a large-scale cluster soon. And when that happens, our medical system will not be able to handle it. People need to remember this before they plan events or activities and think about how their behavior can prevent a large-scale outbreak here in Japan.
This is all important information, but many people are worried about how long the situation will last.
How long will the battle against COVID-19 continue? Viruses are generally said to spread when conditions are cold and dry. But some experts say this new strain is different.
I think we have to assume that coronavirus can spread efficiently in tropical areas. We have to move forward and respond to this outbreak with the presumption that transmission in any area can be effective regardless of their climate.
The virus is already spreading in countries in the tropical regions of Africa and South America. Some experts believe that it will take even more time to bring the global situation under control, since the virus has already made it to the southern hemisphere.
The virus will continue to spread in Africa and in South America, and then this is going into winter time for them soon. Then the virus will spread very severely in those countries.
The battle against COVID-19 looks like it will last a long time. The number of patients has already exceeded that of SARS. This chart shows 3 ways to fight infection. Which do you think is the most effective method?
Well, a vaccine takes time, and we have no idea if we can actually make one. Second, herd immunity. That only happens when lots of people are infected, let's say 70% of the population. Many people will die before this happens. And then there's controlling the virus by taking measures to change our behavior. That's what we're doing now. We're trying to place only minimal restrictions on social activities, unlike China, while also slowing down the infection as much as possible. By continuing to do what we've been doing, we do have a chance to control this virus to some extent. I think we're at a stage where there is some hope. We need to take thorough measures to prepare.
While scientists work to find treatment, the impact of the new coronavirus on society is increasing every day. This fight against this virus will continue for some time. So how should we deal with it as a society and prevent the spread of anxiety? Taiwan has drawn plaudits for its response. It has managed to limit the number of cases to 169 and the number of deaths to just 2.
Children arrive at school. Life continues as normal in Taiwan, where authorities have successfully implemented strict preventive measures. Thermographic cameras are set up at school gates. If a child shows a temperature higher than 37.5 degrees Celsius, they are sent home. They're checked again before class starts. The school contacts parents of children with high fevers. They have to report their recent movements to the authorities. How was Taiwan able to implement such measures so quickly? The government delayed the start of the semester by 2 weeks in February to head off mass infection. This allowed schools to put in place preventive measures for when they reopened. These included clear standards to guide closures. If one student or teacher was infected, the individual class was shut down. 2 infections, and it was the entire school. An online learning system was also put in place. The government ordered the development of a virtual classroom. It's now ready for immediate use.
目前我觉得我们台湾在防疫措施上做得相当成功啊，因为各个政府的部门呢对学校都非常关心，只要学校提出的需求，政府部门呢就立即协助。
Chen Shih-chung is in charge of all coronavirus measures in Taiwan. He has the same authority as a prime minister. He granted NHK his first exclusive interview since the start of the outbreak.
好，那在心理上面哈，我们必须要全民大家能够团结一起。那要让大家能够团结一起，必须要让全民知道哈这各种的情况。好，那这样会让人民有一个信心，就是说我们是通盘考虑过的。那该怎么做或下面的细节。 今天没有确诊的案例。
He holds a press conference every day to give updates on the virus. He covers a wide range of topics, from new infections to warnings to citizens. In response to panic buying,
其实台湾的那种相对的民生物资哈是绝对不会缺的。 好，那大家想想看，我们的日子都在过，这物资本来就在，哦，所以过度的哈来这样的存这样的物资或过度的抢购是没有必要的。
He spends nearly 2 hours answering every question in order to put citizens at ease. Taiwan is also taking measures to fight against the shortage of everyday goods. The government manages all face mask stocks and sells them at pharmacies and convenience stores. Adults are allowed to buy up to 3 a week for themselves and 5 for children. You have to present your health insurance card to buy any, and the system records purchase history to prevent hoarding.
暂停的，不能领，因为你那个上次才领过。 他卡就知道说他还没有满7天，还没有满7天就不能领。
The government also developed an app to help people who are too busy to go to the pharmacy themselves. You can use it to make a reservation and pick up your order whenever you want at a 24-hour convenience store.
好，你要找一个简单的事情，做出一个有效率的决策，让大家看到你这个效率的结果。 那经由小的政策来建立人民对你的信心，那接下来你的大的政策，大家才有办法跟你配合。在对抗病毒的时候，其实病毒来袭哈，一个是来侵犯我们的心理了，一个是侵犯我们的生理。说我们每一天好定时的跟国人报告全部的情况，让整个疫情透明化，让民众跟政府能够站在一起，那我们共同防疫才会成功。
Professor Kaku, what can we learn from Taiwan?
It's a great model. It is a very detailed response. They made thorough preparations and were 1 or 2 steps ahead of the outbreak, putting their measures into practice. I think it's very important to explain whatever the plan is to the public and build a system of communication. That's crucial to take on infectious diseases.
They were also thorough with information disclosure.
Yes, that's very important. You have to do that properly.
Professor Kaku, how should we fight this virus?
As Professor Oshitani said earlier, we need to do what we can as individuals. And we also need to work together as a society. I think the Taiwan model is clearly effective. The way to overcome the virus is for individuals to protect themselves, and for individuals and society to work together to deal with the problem. We have to do this together.
Professor Oshitani, as a specialist in the containment of infectious diseases, what do you think our approach should be?
I think this virus is very difficult to come up with effective countermeasures against, but Japan has managed so far. There were some people who thought Japan would be the first country to suffer from the epidemic because of the Diamond Princess and our low testing levels. But we've managed to keep the number of infections low so far. I think now the world is looking at what we did as far as countermeasures. You're seeing the United States and countries in Europe experience overshoots. But despite our worries, none so far in Asia or Africa. Japan's experience could help many countries around the world fight the coronavirus. I think by bringing together the knowledge of the world, and everybody starts taking this problem more seriously, having everyone in the country start thinking about countermeasures, then we can overcome this virus.
So we can overcome this crisis by changing the way we behave and live. For now, NHK will continue to bring you the latest information about the new coronavirus.
Our guests were Professor Oshitani of the Graduate School of Tohoku University and a member of the Government Expert Panel, and Professor Kaku at Tohoku Medical and Pharmaceutical University. Thank you for joining us.